Hello, everybody, and welcome to Lunch and Learn on Thursday, October 7th, 2021. My name is Holly Dinney, and I am facilitating our program, which is called Lunch and Learn. It is a weekly program we do every Thursday, in that we invite guests to lunch, and everyone on this call is our guest for lunch, and we are talking today to folks from Zufall Health, which, oh my goodness, the programs that they have are many and wonderful. And I want everybody to know that we are recording today's conversation. So you will receive a copy of this program, probably if not tomorrow, early next week. And we're going to post it on our YouTube channel. We are also going to share some contact information and slides that our speakers will share with you today. So I love to say we're having lunch with an expert, but today we have several experts. We're giving you a lot for your money. So what I'm going to invite you to do is to listen. Don't panic about writing everything down. We will be sending out follow-up information. And if you have questions as we go, and we will be sure and follow up afterwards. Okay, so I am going to turn it over first to, we have three folks from Zufall with very different roles who are going to share with us about their specific role, but then they're also, I'm going to tell you a lot about how they connect and how they're different. So we're going to start with Giovani Estacio, and Gio is he's the Sussex County Outreach contact, and Gio was out doing his job one day, knocking on doors in Newton to introduce himself and the wonderful services of Zufall, and he came upon our offices. So I'm very grateful for his outreach. And Gio, why don't you tell us a little bit about your role with Zufall? And I assure everyone that we will make sure that you have Gio's contact information, because if you don't know who to go to regarding Zufall Healthcare, I think he's the guy to start with. So Gio, take it away.
Hey, Holly, thank you so much. Hello, everybody. Hope everybody's doing good on this afternoon. So my name is Giovani Estacio. I've been with Zufall for 5 years. I'm the Sussex County Outreach Representative. My job is to link individuals and families to our health services in Newton. Am I still online? Because I saw that you guys froze for a little bit. Yeah. Okay, so I'll be starting my PowerPoint and I'll be telling you guys a little bit about Zufall. But real quick before we start, let me put up the slide. Oh.
Thanks for your patience, everybody. We love technology, but technology takes a little work. You're doing great, Gio.
Well, I can't. Anybody knows where the play button is at? I can't find it.
Go to the slideshow tab. It should be at the top next to animations, I think.
Or you can even just click on the slide that you want, Gio, where that's highlighted. I think it'll go through for you, right, Krista? My biggest takeaway is that COVID and Zoom has taught us all patience. So thank you for practicing your patience with us. And Gio's still smiling, which I love. Gio, we see your screen. I don't hear you though. You're muted. And you're still muted.
Okay, can you hear me now?
Now we can.
Okay, so let's start with the poll question. How many of you guys have heard about Zufall before?
I think Krista's going to throw up a poll and people will have an opportunity to respond.
So everybody responded already? Yeah, Krista?
Krista, can you let us know how it's going?
Okay, good. So yeah, I would love to tell you guys more about my organization. So Zufall, we're a federal qualified health center. Our mission is to provide the highest quality of affordable healthcare service to the community, regardless of the insurance status or ability to pay. Um, at Zufall, yes, we take patients with insurance, but we also take uninsured patients. Those that don't have insurance, we offer the uh, federal fee discount program to make sure that we deliver the most affordable access to our services. These fees are based on the service that our patients are getting, and it's based on the family size and the income, and it's adjusted based on that. So, a quick little history about our organization. Our organization started back in April 1990 as a door-free clinic. It was founded by Dr. Robert Zufall, and is the gentleman on the picture to the left, and his wife, Catherine Zufall, the woman in the middle. The one to the left is our CEO, Evo Turbine. So Dr. Zufall and his wife, they saw a huge need in the community of Dover for the underserved and uninsured. So with a couple of volunteer doctors and a couple of grant from the United Way and Robert Wood Johnson, they began to serve the community of Dover. In 2004, we became a federal qualified health center, which made us eligible for state and federal funding, which allowed us to expand our services to our patients. In 2007, we were renamed after our founder, Dr. Robert Zufall. So that's why we're named Zufall Health Center. And in 2013, we became a patient-centered medical home, and we have grown a lot ever since. We have a couple of locations in different towns, and here's a list of the locations that we have. And we have a recently new location down south in Plainsboro. That location we just opened up like about 2 months ago. Was everybody still with me? Just to make
We're
sure.
with you,
Yeah,
Gio.
okay, sounds good. So at Sufo, we offer primary care to individuals and families. We are here to ensure that you guys receive the necessary care that you and your family need. With that said, we're not an urgent care. We're not a hospital. We're not a one-time shop. We don't want you to come to us if your doctor is closed or if your kid's pediatrician doesn't have certain vaccine. We want you to become our patients because we're here for you for the long term. So we're here to keep you healthy when you're feeling good, and we're here to take care of you when you're sick. Um, so we do. Sorry. So we offer physicals um, for those that have chronic illnesses like diabetes, hypertension, and asthma. We're here to help you with that. Um, in UN, we have a family doctor, Dr. Kinoshita. He's great. He sees both men and women and children. But if you want to see, for example, just a gynecologist or just a pediatrician, we have that at our Dover location. um, so at SUFO, we participate in the 340B drug discount program, which we partner with certain pharmacies, and we're allowed to, sorry, no, and we're able to give medication to our patients at a discount price. And this is very good for those patients that don't have insurance because they get the medication at an affordable price. For example, I have my grandmother who's uninsured, and for her diabetes medication, if she was to go to ShopRite, it would cost her about $900. But since she goes to Goodell Pharmacy, which is one of the pharmacies that we partner with, her medication is only $12.
I'm giving you a wow on that. That's pretty cool.
Yeah, thank you. So at SUFO, we have pharmacy counseling. For those patients that have diabetes, we have a counselor that will sit down with you, advise you how to take your medication. We have a nutritionist that will sit down with you and tell you about the proper diet that you should add to your lifestyle. At all of our locations, we have a lab court, which is pretty neat because when our patients have to get their labs done, they don't have to go too far. They could just come up from seeing our provider and just go straight to either in Dover, like the basement for LabCorp, or in Newton right there. The good thing about having a LabCorp in our facilities is a benefit for those patients that don't have insurance, because they get the labs at a discount price compared if they were to go to a regular LabCorp. Also, we have behavioral health services in our center. That's for our patients. They get prescribed by our provider. So if you're feeling depressed, or you're feeling stressed, or you need someone to talk to, we have behavioral health counselors at our location. We also have Ryan White, which is a program and is very confidential. And we offer confidential testing and treatment for people that have HIV or AIDS. And we also offer counseling, and we help them with housing and other different programs. So in our center, like in-house, we have a neurologist, an optometrist, and a podiatrist. So first you see a regular provider, and we'll prescribe you to one of them if you need to see them. But if you need to see an outside specialist, such as a cardiology, then we'll refer you out to one of those. So in Zufall, we have the Title 10, which is family planning. We provide affordable and basic reproductive health services to our patients. We provide contraception to men and women to prevent unintended pregnancies. We provide sexually transmitted disease screening and treatment services, breast and cervical cancer screening. Um, so all these services are very confidential. For example, someone that is 13 and older, we encourage them to let their parents know. But if for any reason, like they want to keep it confidential, by state law, we're not allowed to disclose it to their parents. Um, I mean, as a parent myself, I have a daughter. I'm happy even if my daughter doesn't want to share it with me, knowing that she's going to her doctor and getting the service and the needs that she needs. So for dental, so yeah, we have dental. We got regular dentists for adults, and we have a pediatrician dentist. We do preventive care, which is like cleanings. We do fillings, we do crowns, partials, dentures, extractions. Um, the first visit is always you come, you get the X-rays, you get the full mouth checkup, and you start your treatment. And then from there on, you make your follow-up appointment to get the service that you need. We do take emergencies for our patients. If you're feeling pain or discomfort, you could give us a call, and we'll squeeze you in for the day. For dental, the only private insurance that we take for dental is Delta, and we just take like the state insurances. We don't take any of the private insurances. But if you're unsure, or you have a private insurance that we don't take and you want to be seen, we'll put you on the federal discount slide that we have, and your appointment you'll be charged based on your family size and your income. So it's pretty affordable compared to going to a private office. So for our patients, for medical, we take all insurances, um, private, state insurances. The only insurance that we don't take is AmeriHealth. Um, but we encourage our patients to get insurance, and we have someone out at our center that can help them with that. We have a representative. Her name is Maria. The open enrollment is between November 1st to January 31st. If anybody's interested in enrolling in insurance, they could give us a call to our hotline. If someone doesn't pick up, they could leave a message, and we'll call them back to make an appointment. And our representative Maria will help them find the most affordable and the best plan for them and their family. So when you how to make an appointment with us, it's easy. You just give us a call to make an appointment. Also, I know with COVID, if you have symptoms or you believe you have COVID, to keep our patients safe and to keep you safe, we're doing telemed visits. So in the era of technology, we'll make an appointment. You could use your smartphone, you could use a computer, anything that has a video, or by any chance you don't have any of those, with the regular just phone call, you could talk to one of our doctors, and it'll be like a regular visit, and it's safe and it's secure. So if you come for an appointment for the first time, if you have insurance, you bring your insurance cards. If you don't have no insurance, then you bring an ID with you, proof of address, and proof of income. So here at Zufall, we have joined the fight against COVID. We have off-sites where we're doing vaccination and testing. Um, every Tuesday and every Thursday, we have an off-site at the St. Margaret's Church in Morristown, where we vaccinate from 9 in the morning to 1 p.m. Every Wednesday in Dover is from 9 in the morning to 1 p.m. If you want to make an appointment to get your vaccine, you could either give us a call or you could go into our website, superhealthcenter.org, and make an appointment. We also have COVID testing, and it's usually in the afternoons. So it's Tuesdays and Thursdays in Morristown, St. Margaret's Church from 1:30 p.m. to 3:30 p.m. It's Wednesdays in Casa Puerto Rico from 1:30 p.m. to 3:30 p.m. And it's Fridays in the morning from 9 in the morning to 11 a.m. For these, we encourage our patients or anybody who wants to get tested to make an appointment, either on the website or to give us a call. But we take walk-ins. So vaccination is free. Anybody who wants to get who's 12 years and older, people that are like 18 and older could have the option of getting the Moderna or the Pfizer vaccine. If you're 12 and 17, then the only vaccine that you could get at the moment is the Pfizer vaccine, and it's completely free. And for testing, we don't have the rapid test. We have the nasal swab, and it's processed by LabCorp. So from our part, it's completely free, but LabCorp will charge you insurance if you have insurance. If you don't have insurance, then the Federal Care Act will cover it. But just so you know, I think if you do it routinely, because either you have to travel for your job, then they might charge you for it. So here we have our mobile clinics. The one on top is our medical van, and the one in the bottom is our dental van. With these, we go see special populations such as the homeless, public housing. We see veterans, we see farmers, and it's basically like a clinic on wheels. We do pretty much everything that we do at the sites in these. We have like the patient representative who does like the front, the clerical stuff. We have the medical assistant and the provider, and we have two bedrooms. I'm sorry, not two bedrooms. We have two rooms in it, computers, um, and we do physicals, sick visits, and in the dental one, same thing. We do X-rays, we do fillings, certain extractions, and in these an interesting thing. So I've been with Sue for 5 years, and I started as one of the drivers, so I used to drive these. So yeah,
That's great. Thanks for sharing that, Gio. Pretty cool.
thank you. So I have another poll question for you. Super health is
We need Jeopardy music.
yeah, we do.
Okay.
Great, wonderful.
A plus.
So everybody, so here's my contact information. If you guys need help making an appointment, or if you guys have any questions, or you guys want to link up with any of our services, feel free to give me a call or send me an email. I would love to help you. And right now I'm gonna pass to Nicole, who's gonna talk to you a little bit about our MRAP program. Okay, thank you very much.
That's great. Thank you, Gio. And Nicole, make sure you give us a little intro on you. You guys all wear so many different and interesting hats.
No problem. So my name is Nicole Matos. I am actually a case manager for one of our maternal recovery programs, support programs here at Zufall. I've been with Zufall for about almost 3 years. So right now I'm working within our programs in the behavioral health department. So I'll touch on a little bit of that, of especially how Gio mentioned it a little bit already, but definitely a little bit more in depth of our services for our patients. And overall the programs that I assist with as a case manager, as well as my other colleagues. So I'm going to share the screen. Is it popping up for everyone? Awesome. Okay,
We see, and I just want to make sure everybody knows, somebody had put in the chat while Gio was presenting, we are sharing, thankfully, our presenters are sharing the slides with us. So we will be sharing both the slides and the recording because there's a lot of information, really helpful information on these slides. So worry not, it's coming. Go ahead.
So here is overall, the programs are going to be both called the maternal recovery supports programs, because what we do is that we support moms that are pregnant and parenting children with minor children, specifically with substance use. So I'm going to kind of go a little bit over that. So that's kind of what the program maternal recovery means. So that way to be able to support the family both for moms during pregnancy and also for parenting moms. So a little bit about our behavioral health at Zufall, as Gio mentioned, we do have behavioral health services within Zufall for our established medical patients. So we do a whole person health. So as Zufall, very similar is that we help the patient overall from head to toe. So with this, we actually have two initiatives in our behavioral health, which trauma-informed care and learning community, which is trainings for our staff and other providers. For those that, especially with the trauma-informed specific criteria, but main thing for our patients that come to Zufall is the integrated behavioral health care. So kind of how Gio mentioned is that when a patient comes to Zufall and they mention to the doctor that they're feeling depressed or anxious about even a lab result that they may have received at that appointment, one of our clinicians can meet with that person on site and talk with them about how they're feeling, and also get a follow-up from that with one of our clinicians. So it's that not only you're coming for primary care, but you're also getting the behavioral health side and mental health side to offer that support. So we do have 20 staff in our behavioral health department. Majority are bilingual. So definitely our community, we kind of are broad-based for all of our services. We have the clinicians, as Gio mentioned, we have the behavioral health case managers. So not only with the clinician, but if you have a certain application or something you need assistance with, like even for translation with phone calls, a behavioral health case manager can help with that. So that's something through the behavioral health department, they can work and make that connection. Outreach, which is kind of one of our programs and some of the other programs within there in our administration. But overall, we have the counseling services, brief intervention, crisis assessment, and case management. What I'm really here to talk about today is the maternal wraparound or MWRAP program that we offer in Morris, Sussex, and Warren County, as well as our Somerset maternal recovery support program is specifically for Somerset County. So what the maternal recovery support programs offer is intensive case management services, support, and comprehensive plans to help pregnant women as well as parenting women with all substance use disorders. So this can be marijuana, alcohol, tobacco, any type of substance that would fall under it, as well as illicit or illicit. So what we mainly focus on is our connecting them to dental and medical services, and especially during pregnancy, prenatal care. So this can be if they're running into no insurance, we can help them get connected to the charity care within the prenatal care departments, as well as just overall health in any of the counties that they reside. And also our internal behavioral health as well as external. So if there's any type of medication management for any mental health, we can help connect with those. Substance use treatment, and is also other recovery support services. So that can be, for example, peer recovery support that have a person that's been through recovery themselves through different agencies, and just even meetings as well for some of the moms. We also too offer referrals and information about housing and financial. So we kind of help with those directions and navigate those systems to make it a little easier. I always say, instead of going on Google and trying to look up 20 different things, we're help kind of navigate that and narrow it down for the mom or for the patient. And also to transportation, meaning that we help connect them, fill out those logistic care, setting all those appointments up. If they need assistance with Lyft, we may be able to help with those kind of services. Any woman or any parent, especially specific maternally, that they do not have to be a Zufall patient to receive these services or any other Zufall services in general. So if they're coming here, they don't have to have medical, they don't have to have dental. They can just say, I need assistance with some case management services, and they can reach out to me or one of my colleagues to discuss this program and see me able to help. So the two programs that I mentioned is that the maternal wraparound, which is MRAP, which is the counties that I cover, which is Morris, Sussex, and Warren. This is specifically for pregnant women. So anyone that's pregnant at the time and they may be in recovery or trying to navigate it, we would have that program would be specifically for them. So that way would be during that pregnancy and up until that actual due date. And it's also too, they have to reside in 1 of 3 counties over the age of 18. And also too, we offer a peer recovery specialist while they enroll. So once they enroll with our program, their peer recovery specialist will reach out to them automatically. With our Somerset maternal recovery services, very similar as far as the age and the criteria. Only difference is that this program specifically is for pregnant and parenting minor children. So mom can have a 3-year-old and a 4-year-old at home and be interested in our services for the Somerset County. So they can still get case management services while being parenting older children or younger. Also too, they can be pregnant. So the Somerset kind of has more of a broader scope of being able to have more eligibility, while MRAP for Morris and Sussex is more specifically for pregnancy. How it usually if you were interested in the program and know anyone that may be pregnant or has any type of used a substance during that pregnancy. This also includes with recovery is maternal assisted treatment, medically assisted treatments. So methadone, buprenorphine, like Suboxone or Subutex. During that pregnancy, we can offer services to the client. It's a voluntary program. So if someone starts the program and says, you know what, I'm busy with work or it's a lot for me to do at this time, can I stop this program? The answer is yes. It is also not a mandated program. So if any court or program says you have to do it, we are a voluntary program. We work with the patient and meet them where they're at. So if someone is interested, we would speak to the client, discuss the program and how we might help alleviate some barriers. So connecting to WIC or food stamps or anything like that and help navigate it. And then help them connect to those. And then they enrolled in the services. Once enrolled, both programs are for 1 year. So that could mean is that if they're pregnant, it's offered from the pregnancy up until the baby's first birthday. So we follow them all the way technically almost a year and a half, 2 years based on when the pregnancy is. But if it's a parenting mom for the Somerset program, it will be from the date of enrollment. So if it was today, then it would be next year would be the term of the program. I have here both contact information for myself and also to my colleague Carla, who is for our Somerset program. With these programs, you can call us, fax, also to the work cell phone. We are okay with text messages if anyone feels uncomfortable reaching out to us, saying, I've heard about your information, I'm interested in the program. We can then give them a call to follow up on that. And then I also have here all of our contact information. So if there's a specific question that you may have about the behavioral health services at Zufall, Sarah Ailman is the director. She'll be able to answer any behavioral questions within the department, as well as you have my contact information for the maternal wraparound program, as well as with our recent expansion, we used to only be opioids only, but now we're all substances. So we have a new case manager, Margarita Ramirez. So her information's here as well. She's our bilingual speaker for the program. And then also to Carla for our Somerset. Most of our services with these programs is our goal is to really help mom and baby have an overall healthy pregnancy, and also to just help remove any barriers they may be facing and support them through this process, especially in the recovery world, basically helping navigate the treatment as well also to navigate being a mom. So definitely we're just offering overall support in both of those areas. So that's kind of an overall of what our program does. It's overall just as a way to help and support our patients and within Zufall and outside with navigating the world around them, especially during this time of pregnancy and parenting. But if any questions, I'm here.
Nicole, we had a question in the chat involving if a mother has a substance use challenge, there may be fear of repercussions or DCPMP getting involved. Like, what's your take on that, or what's your advice or your experience with that?
Sure. So that is actually one of the things that we help out with our program with DCPMP or DIFUS, is that we help navigate the plan of safe care. So what that means is that we help create a plan during that pregnancy to help mom navigate what DCPMP may be asking. So if it's requesting to get connected to treatment or benefits, we help in that piece of it. When it comes to reporting, we're meeting mom where they're at. It means that we are mandated as if we see a concern, but our main goal is really to help mom, especially during the pregnancy. It's where we help. It's one of the elements that we do include in it, as well as it that we help with the plan of care. So DCPMP, we work with also to them in plan of safe care meetings. So I sit on as an advocate for the moms that may be enrolled in our program. So if a mom's enrolled with us and she has a case with the division, we will be able to help work with them and say what plan they're working on, what treatment, what the peer recovery specialist, being in that mom's corner, if she's navigating it, especially, for example, a mom that may be on a medically assisted treatment like methadone. Mom's been in recovery for 5 years. She's on methadone and DCPMP is involved because of it. Just for that specifically. We help then create that plan with mom, DCPMP, and help support her as she gets before that due date. So it's overall support system is that we help with that. And if we do see a concern, that's something that as a state we're mandated, but our main focus is really to help mom where they're at and help work with them to make the pregnancy and delivery easier, especially with working with DCPMP.
Thank you, Nicole. That's a great answer. I appreciate that perspective, because I think we're all trying to work together, right? DCMP included, they get a bad rap sometimes as kind of being the mean disciplinarian, when actually they're really looking out for the welfare of the child and the mother and the family. And the peer recovery specialist is a neat piece too, because don't statistics say that when a peer recovery specialist is involved in the mix, it's a much better outcome in general for the person in recovery, right? I mean, I think that's pretty well documented.
Yes, and definitely it's really beneficial. And it has shown that, as you said, the studies and the progress it's had done over the years of implementing it more, especially in hospitals. If anybody comes in the hospital after a withdrawal or overdose, there's a peer that's there to help. And with our program is that we have that automatically connected to help in that piece. So sometimes the peer can meet the mom for meetings on the weekends. So that's a part of our program that not only is the case management side that I help out with or navigate, you have the peer for those moments that after hours that mom needs that extra. And it's someone has walked in the same shoes. As I say, that it helps them understand. And some of the women that I work with as peers, they're moms themselves. So they can not only answer questions about the recovery, but navigating recovery and parenting at the same time.
Wow, thanks for sharing. That's a great story, Nicole. And who do we have up? Jen, who's patiently waiting. I think we've got Jen Salt on tap next. Were you done? Did I stomp on you, Nicole, or were you done?
Nope, that's it.
Excellent story to tell.
Your turn.
Thank you. Take it away, Jen. Let's start with a little introduction of yourself, if you will.
Of course. Hi, everybody. My name is Jennifer Salt. I am a registered dietitian and certified health education specialist. I have been with Zufall for a little over 3 years. So Nicole and I started right around the same time, I think. But I am the director of SNAP Ed. So that is what I'm here to talk to you all about today. So let me just share my screen. All right, are we good here? Okay. So, sorry, I'm trying to move my little thing here. SNAP Ed is kind of a sister program to the SNAP program. So if any of you don't know what SNAP is, it's a supplemental nutrition assistance program. So that is formerly known as food stamps. So I just kind of want to start here. There are some helpful information here about phone numbers for each county if you know of anybody or yourself are looking to enroll in SNAP services or benefits. To the right, you see the chart here tells you about how much money is the maximum income level for SNAP in New Jersey currently. So where does SNAP Ed come in? So we are the Supplemental Nutrition Assistance Program education. So our team works on nutrition and physical activity education. And our goal is to help low-income New Jersey residents make healthy food choices within their limited budget. You can see here that we have kind of 3 different wings, I'll say. One is direct education. So we go out and do direct education to participants. We do policy, systems, and environmental change. So that is more, we work with organizations on making the organization the healthiest place it could be. So we work with wellness committees and things like that. I'll get more into that. And then we have indirect activities and marketing, and that's kind of a little offshoot. We don't do that as much. We really try to stick to the direct education and policy, systems, and environmental work. The marketing is actually done at the state level, so we don't even have to worry about that at all. So our classes, we get all of our interventions and curriculum from the New Jersey Department of Health. So all of our interventions are behavioral change focused. They're all evidence-based. So what our lessons really teach are about eating more fruits and vegetables and whole grains, drinking fewer sugary beverages, increasing physical activity levels, maintaining the appropriate nutritional balance at all life stages, and kind of shopping healthy on a budget. That's one of our big pushes as well. Now, our audience is participants in Hunterdon, Somerset, Morris, Warren, and Sussex counties. So we cover 5 counties, not all the counties that Zufall covers. We have just a little section of it. But so we work with residents in those counties that are eligible for SNAP. So they do not have to be enrolled in SNAP, but at least 50% of our classes have to be eligible for SNAP. That being said, we do not take any personal identifiable information from folks. So we don't ask, I mean, sometimes we'll ask a name just to have a conversation, but if you want to give us a fake name, that's totally fine. But we do not ask for any income information or anything like that. So what we do is we ask for an agreement with an agency that says, yes, this is the population that we serve, and then we can do education with that agency's clients, things like that. If you are just a resident, you could always reach out to me. I have my contact information on here. We can see if there's classes going on in your neighborhood. We can always connect you that way. So as you can see here, we have quite a few direct education curriculums. Now, some of these, as you can see, are for kids and teens. Most of them are for adults. Some of them are one-off classes. So that means we just come, we do one session of education, and then we're out. Some of them are series classes. So it could be 6, 7, 8, depends on the program, series classes. So it works really well for agencies that have a group that already meets together. So say you're a faith-based organization and you have a Bible study on Tuesday evenings, we could come in and do a little lesson with that Bible study kind of thing. So those sorts of things work really well, we've found in the past. I will tell you that some of these programs are brand new. Our grant year just started this month. So some of these are brand new to us. So we are still learning them too. So please keep that in mind. But we do offer most of these virtual and in person at this point in time, just to be aware. So if you guys if anybody has a group that meets virtually and would like to kind of introduce one of these programs, we can do that. Or we at this point are allowed to go in person. What you can expect at some of our classes are, we like interactive learning. To be honest, we just get tired of talking at people. So we like to have conversations. We can do, like I said, in person or virtual. We do, pre-COVID, we were doing taste tests or food demonstrations at every class. During COVID, we've stopped that. We're trying to figure out when it's going to be safe to get back into that, or if we do take-home taste tests. So we're working on figuring that out. We do offer incentives for every class. So we have tons of giveaways. So if we're doing a class on how many cups of fruits and vegetables you should eat, we tend to give you a measuring cup so you can make sure you're having that many fruits and vegetables. This is a bunch of our exercise incentives in the picture. And then we also offer recipes. So typically we offer a recipe that goes along with the class, at least one recipe. And we do survey participants for our program. The surveys are voluntary, they are anonymous. Any series class, we do a pre and a post survey to see if there's been any behavioral change. And then any one-off class, we just do a post survey. They do ask some demographic information that is basically collected to give up to the federal level for, because SNAP-Ed is a national program. We also do policy, systems, and environmental interventions. So the idea with these is that we do more long-term sustainable changes, and we kind of work with targeted communities in each county. Some of these programs are for faith-based organizations. We work with schools, we work with corner stores. This year, you can see here is kind of like what we call the produce pop-ups. We do a lot of these in Sussex County. There's one today at 2 p.m. at Miriam Avenue School in Newton. So if anybody wants some fresh food, I'll be there shortly. We've started community gardens. Out of school time is a program that is for after school programs. So trying to make that after school program, making sure that kids are getting enough physical activity or having healthy snacks, that sort of thing. We do a lot of coalition work. I think we're involved in 16 different coalitions at this point in time. And then Veggie Van is a new program for us this year. So that just started. We are looking to use our Zufall Eats van to bring more fresh food to different neighborhoods. So we're open to learning how to do that. So keep that in mind. This is our Zufall Eats van. Hopefully some of you have seen it around one of your towns. We did receive a grant. This is kind of outside of SNAP-Ed. So this is a separate grant we received to purchase this vehicle and get it running. Since December, we have given out over almost 20,000 school or summer meals. We partner mostly in Dover for that with the Dover schools. We do, while the kids were virtual, we did meal distributions with the school district. And then during the summer, we did extra summer sites so that kids could get meals in other places. And then we also partner mostly with the Sussex County Hunger Coalition, and we kind of pick up food from different pantries or grocery stores, or we work a lot with Local Share, who collects food from farmers that are not going to use it. They use their volunteers to kind of go collect a bunch of food, and then we give it out at these free produce pop-ups. So that's almost 10,000 pounds of food. Probably at this point, I think this slideshow is a couple weeks old, so we have even more, given away more than that in food. And then we also are running this Grow Garden State program. So this was a new program we just started last year. So we're going to hopefully amp it up even more this year. It is a Facebook and Instagram account. So it's kind of like a social media campaign. And what we're trying to do is help SNAP eligible New Jersey residents. So this program we do statewide. So this is open to all of New Jersey. So we're hoping to help them learn how to grow their own food. So what they do is if anybody enrolls in the program, we send them their seeds, and we have information on how to grow the food and all these different tips and tricks on our Facebook and Instagram accounts. Also we offer a lot of challenges that have lots of fun prizes. So like gardening kits and tools and things like that. Last year or this past year, we just did lettuce, cucumbers, and green beans. So we are trying to figure out what to do next growing season. So if you have any ideas, let me know. And that is a quick rundown of what we do. So if I talk too quickly, if anybody has any questions, please let me know. This is my contact information. It will, I believe, Holly and Krista, you have my information, so it will be going out with the presentation.
It will be. And if I can, Jennifer, if I can ask you a question, I know the pop-ups are something that we get a lot of questions about from our families. Is there a place or how would someone who's interested in your schedule for those, how do they find out about that? Or is there a website, or what do you recommend for that?
So I do have a constant contact, like an email account. So once we have the month's schedule, I will send it out that way. But we also put it on the Sussex County Hunger Coalition Facebook and Instagram accounts. So you could always follow Facebook, the Sussex County Hunger Coalition on social media, and they post the dates there.
And those pop-ups are both in Morrison, Sussex, and another county, right? Or are they?
They are primarily in Sussex County right now. We do have a couple. Our last one in Victory Gardens in Morris County got very rained out. We tried to stay there, but didn't last very long. The rain was coming at us sideways. So we partner with other agencies. So like right now in Dover at the middle school on Mondays from 5 to 6, except for this coming Monday because the school's closed for Indigenous Peoples Day. There is Nourish New Jersey is at the middle school in Dover from 5 to 6 giving away free food. And they often have like eggs and dairy and things like that too. It's not just produce.
So what I'm hearing you say is you would recommend two great resources to follow would be Sussex County Hunger Coalition on
Mhm.
social media, on Facebook, and also Nourish New Jersey, because there are, and keep this in mind, folks, there are opportunities for food and healthy food and produce to be shared at no cost frequently, really, right, Jennifer? I mean, there's a lot of work put into that, a lot of success with those programs.
Yeah, and I will say right now in Sussex County specifically, this is going to be the last month for most of our pop-ups simply because of the growing season in New Jersey, but we do one at Norwest Cap in Sussex Borough, and that will be going year round because they have indoor space and we have other resources. So we will be going to be doing Sussex year round. So we just got to figure out that schedule. Actually, it's the third Thursday of the month, so that's easy. The third Thursday of the month at Norwest Cap in Sussex County, in Sussex Borough. My apologies.
What time is that? Third Thursday of the month? At what
It's
time?
4:30 to 6:30.
That's great information.
Mhm.
That's really great information. I'm going to watch the chat and see if there are any questions. This has been an action-packed, detail-oriented sharing. So thank you so much for all of that. But I have one question just in general is what happens with our undocumented population for any of these services? I mean, the reality is I'm hearing the vibe that we're here for the families. We're here for, which I really, I value, and I know how important that is, whether it's a young mom or a to-be mom who's struggling with substance use, or folks trying to figure out how to eat healthy on a budget, which is not easy. I mean, it's a lot less expensive, right, to make choices that may not be the best for us and for our children. But what happens with folks who, in general, who are undocumented and I know don't have insurance? Doesn't scare you away at Zufall, right? Like you have you have folks that can help figure out insurance options, but you also have other plans. Like, what can you say about that topic?
So for SNAP
Anybody.
Ed, yeah, like
Yeah.
for SNAP Ed programming, there is no information taken. So I don't know where you're coming from. Anything like that does not matter for us.
Not required.
Yeah, same thing for medical and dental. You just gotta show an ID. Doesn't matter where it's from. It could be from your native country. The ID is just to like match the picture to the name, just to see it's you. And yeah, I would say we have a large, like most of our patients are undocumented. So like in not so much in Sussex, but for example like in Dover, yeah.
And
That's
for-
helpful. Go ahead. I'm sorry. Go ahead, Nicole.
I was gonna say, because I'll say for our program, we don't ask that like residential question. As long as if they're like even living in like a sample of room and they have an address, they qualify for our program. The same thing like an ID or anything like that. We don't really ask that question, even though we are grant funded. We don't, through the Department of Mental Health, we can take anyone, doesn't matter their status, as long as they have like an ID, or even sometimes our moms are homeless. So it really, for us, it doesn't really, even if they are, it's not an issue for us.
And I appreciate, I know one of our participants before was just recognizing some of the stigma or fear involved in a lot of these scenarios, but I'm hearing you say, and I appreciate that we're really here to provide the services, less interested in documentation and scenario, and more interested in how we can help, right? That's what I'm hearing, which is really encouraging from Zufall. And I see too, someone put in the chat asking a question, I think for you, Jen. Can schools participate in Grow Garden State, such as receiving receipts, and if so, who might they connect with?
Yes, so we love providing seeds to schools, especially. So we do schools, we do organizations, we've sent out. So you can just enroll in the program. If you go to our Facebook page or Instagram page, we'll have the sign up sheet. We don't have the sign up open right now yet, but I think we're going to try, and our goal is to have a big push for the sign up in January, February. So maybe Holly, once I have that, I can send it to you and you can send it out to your contact list.
That would be great. And what we have to keep in mind too, and I know there's some other providers on the call, is these types of presentations. I mean, Zufall is happy to go out and talk to, as I don't know if it was Nicole or Jen who said, if you've got a club, if you've got a church group, if you've got a group of moms that get together on a regular basis, really, it benefits everyone to learn more about what's available, because, word of mouth, I hate to say it, right? You guys can promote like crazy, but when someone